In terms of exercise progression, it is recommended, if a woman is not already fit, that she gradually work up to about 30 minutes a day. Beginners should start with maybe 15 minutes 3 times a week and work up to 30 minutes at least 4 times a week. If necessary, for some of the women we may be seeing, we may start them with 5 minutes and increase them by 5 minutes each week. So at maybe a very slow progression. With any of our women, or anyone who is exercising for that matter, it's important to allow for proper warm-up and cool-down of about 5 to 10 minutes to gradually increase the body temperature, to gradually increase the heart rate. Also, we wanted to let women know that overall activity and fitness levels may decline as the pregnancy progresses. So she may start at a certain point, and as her pregnancy progresses later on, she may actually have to do maybe less time or break it down into smaller segments and actually may have to work at a lower intensity. And the next point here really would probably be pointed out more towards women who are at very fit levels and they're exercising hard prior to pregnancy. We do not want women to continue to increase her exercise, the amounts and duration as her pregnancy progresses. So exercise should not exceed pre-pregnancy levels. And the tip down here on the slide says encourage women to listen to their bodies when exercising. So again, we may want to encourage the women to use the Borg scale, the talk test, encourage them to listen to the bodies when exercising. Also, as I mentioned earlier, strength training is an important part of a fitness program in non-pregnancy as well as in pregnancy. So the general recommendations is that strength training be done 2 to 3 times a week, starting with very low weights, and for pregnant women they can complete 1 set up to 12 repetitions. Women can start with moves that use her own body weight, which would include like wall sits, wall push-ups, or light weight exercises, and build up very gradually and only increasing the weight or repetition when the exercise becomes very easy. We want to encourage women to remember to breathe. Maximal isometric exercises are to be avoided due to the cardiovascular response, avoiding holding the breath, which is called the Valsalva maneuver, because the venous return of the heart can be compromised. Encourage women to stop at any signs of discomfort, and beginners should be instructed on safe technique and how to do these types of exercises. Some general recommendations would be scuba diving is not recommended. Scuba diving, fetuses is at a risk of decompression sickness secondary to the inability of the fetal pulmonary circulation to filter bubble formation. Also, exercise above 6,000 feet is not recommended. Some information from the Institute of Altitude Medicine from Peter Hackett, MD, and Linda Keys, MD, who have researched women in Colorado, mention that women who do live at high altitudes or exercise in high altitudes do have babies that are born at lower weights. However, these babies are healthy. In addition, it's mentioned that pregnancy-associated hypertension and preeclampsia are slightly more common in high-altitude pregnancy. Most of the information is available for women exercising at 6,000 feet or below, and very little information is available at higher elevations. So typically the recommendation is not to exercise above these levels. Already mentioned, after first trimester, the supine position is not recommended. However, some of these exercises can be modified, and again at the end there is one of the references. There is some very good examples of illustrations of different exercises that women can do avoiding the supine position. Also, we want women to avoid exercises that increase risk of falling or trauma. So an example would be soccer, ice hockey, basketball, contact sports, and those that would increase risk of falling, such as gymnastics, downhill skiing, horseback riding, and vigorous racket sports. Women should also know the warning signs when to stop exercising. So these are all listed here, and if a woman is exercising and she experiences any of these, she should contact her doctor right away. Much of the research involving exercise and pregnancy involves women who do not have diabetes. So there is fewer information that evolves around women who are pregnant and who have diabetes. So we want to look at, well, how does exercise impact diabetes management? So with regular exercise, regular participation and sufficient intensity are crucial. We really want to encourage in these women to be consistent with the exercise and to work at intensity that's going to make a difference. The benefits are, with the diabetes, it helps control the blood glucose levels. And this has to do with increased skeletal muscle uptake, enhanced insulin action, increased insulin sensitivity, and also the fact that exercise uses muscle glycogen. A few studies have found these benefits, one being Jovanovic, which is an older study, found that a 6-week arm-ergometry exercise program was successful in normalizing fasting blood sugars and A1C in women who had gestational diabetes. A study about 10 years later by Garcia and Patterson found that women who walked after meals had a decrease in glucose excursions. And then another study by Broxton found that overweight women who exercised were less likely to need insulin. In addition to this, this exercise also helps with weight maintenance and loss of visceral fat. And the lack of postpartum weight loss that we see in many of these women and lack of exercise are strong predictors of increased incidence of type 2 diabetes. So this would be a great time in pregnancy to introduce exercise so she starts this as regular part of her healthy lifestyle. With diabetes, there are, however, some special considerations that we need to take. And we want to encourage women that she may need actually to do more blood sugar testing, especially if she's taking insulin or one of the glyburide, for example. She should always carry some sort of carbohydrate. Meal and snack planning is essential that she exercise around her meal. She has sufficient amounts of carbohydrates. Also, planned exercise may require insulin adjustment, especially if the exercise is done within 3 hours of eating and she's taking a fast-acting insulin. Some general recommendations for anyone who does have diabetes is to watch injecting insulin into the working muscle and to exercise when blood sugar is on the rise, not falling. So preferably 30 to 60 minutes after meals. However, this also depends on the type of insulin a woman is taking. And a woman may need carbohydrates before or right after exercise, and this is why we encourage more testing for the woman to determine exactly what she needs. Some additional exercise tips would be to exercise regularly, preferably the same time, and especially if we're looking at improved glycemic control. For safety, we recommend women exercise with someone, so it could be in a class, it could be walking with someone else, also, or carry a phone with her in case she needs to contact someone. Walking in loops if possible, so for example, women can walk around a track, around her block, around the soccer field or baseball field when her child is practicing, are examples. Strongly encourage women to stay hydrated, always carrying water with her. Wear supportive clothing that's comfortable, and careful select footwear for optimal fit and comfort. And I In my 20-something years of practicing, I have found that a little thing such as the wrong footwear can significantly impact a person's ability to exercise or the continuing of exercise. And one example is a client I saw. She saw me before she actually got pregnant or was planning a pregnancy, and she was trying to lose weight, and it had been training for a half marathon. And I think she actually got to about 6 miles, and she became injured, and her legs and feet were hurting so bad that she stopped exercising. And so when I did some questioning, found that she was actually wearing volleyball shoes when she was running. So we talked about that, and then I didn't see her again when she came in, and she asked for her referral. She came in again during pregnancy because she was trying to control her weight gain, and we talked about exercise. And then I saw her fairly recently. She again asked for another referral because she was breastfeeding her second pregnancy, and she wanted to lose weight, and she actually wanted to start walking again. And we talked about, again, shoes, and she goes, yes, I do remember that you told me not to wear volleyball shoes. I now have purchased some appropriate shoes. So we really want to encourage this for women if all possible. Also, as we mentioned, avoid exercise in hot, humid weather. Here's some general guidelines for diabetes and exercise. Is to aim to exercise for 30 to 60 minutes postprandially if we're trying to control blood sugars. So if a woman is taking a quick-acting insulin, such as regular, this may be appropriate because of the peak of the insulin action. However, if she's on a rapid-acting insulin, she may need to adjust her insulin or the timing of her exercise more appropriately. Also avoid during acute illness, severe cold or flu. Avoid exercising if glucose is greater than 250. Increasing, especially if ketones are present in the urine, because this can actually cause the blood sugars to go higher. And avoid exercising if glucose is less than 60. We want the women above that in order for her to start exercising, because this can, women can have hypoglycemia if she's exercising lower than this. So a tip here is to bring fast-acting carbohydrate source, and again encourage her to carry this with her. These are guidelines for blood glucose and treatment for women with pre-existing diabetes found in the California Diabetes and Pregnancy Guidelines for Care. And the recommended treatment for women who have diabetes and pregnancy is that if she has a blood sugar of over 250, she needs to check for urine ketones. If they're positive, she should not exercise until the ketones are negative. And a blood sugar over 250 in a pregnant woman is not well controlled, and she really needs to call her doctor right away. If her blood sugar is 100 to 250, no extra food is recommended prior to exercise, again, because these are above the guidelines recommended from the Guidelines for Care. She should also contact her physician or whoever is managing her diabetes. If the blood sugar is less than 100, we recommend at least 15 grams of carbohydrate, usually sufficient. If blood sugars are less than 60, we recommend women treat for hypoglycemia, start exercising after blood glucose is at target level.